It's home front, it's Rome. Welcome, welcome, welcome. We are here at the Dwelling, so thank you very much to our friends at Dwellings. Thank you very much to the PED CARES Foundation for making this possible. Remember to donate to the kids. We're doing this all for the children. All right, today is a special episode because when we started off season 2, we had an unknown star in our midst. Dr. Taylor, welcome, Dr. Taylor.
Thanks.
So his episodes were hits. Everyone was talking about it, not only because of the personality that he had on set, but in terms of the information and the behind the scenes. Now, in those episodes when we started on the Frontline, we showed people how we went into the facility, we went into the hot zone. You showed me the donning process of how you all go through putting on your PPE every day. We actually spoke to a patient who was COVID positive. But we have today some footage that was unseen that we want to share with some of the folks today. And while we were in the hot zone, we didn't really get to go in depth because of the PPE, the amount of PPE that we had, or we couldn't have that chat in the hot zone. So today, we're going to look back at some of that footage and discuss some of the things that were happening. And first, I want to start off with a clip that we have when we were passing through the critical bay. Now, I'm trying to understand the levels. Is it that the critical bay means that someone is extremely sick?
Yeah, so we have different levels of care. So we have ward level care, and then we have ICU level care. ICU level care can include HDU, high dependency unit, as well as ICU and the recovery unit. So when a patient is on the ward and they become critically ill, we would usually put them in that ward where they can actually have continuous blood pressure monitoring, continuous vitals monitoring, and it usually means that they are extremely sick. Now, in our specific situation, usually you may have one critical bay, but actually we have actually opened up an additional critical bay because the severity of patients that are coming in with illness is so frequent and is much more than normal. We actually have to extend our critical services capacity.
Now, there's a clip we have here where you're seeing a patient lying on the bed in the ICU unit, and I'm just seeing like tubes.
Yeah, so that is it. It's intensive care. So that means that we have a lot of monitoring, even more than a critical bay. We have extensive tubes being placed. We have tubes being placed in the arteries, in the neck. Everywhere that there's an orifice, you can have a tube placed.
So, guys, we're going to look at a clip because in that episode as well, where we spoke to the COVID-19 positive patient, he was telling us basically where he felt as though he was breathing well at one point, and then in the blink of an eye, he was gasping for breath. So, let's take a look at that clip and hear exactly what it is he said.
So, Mr. Miller, how are you?
I'm okay. Thank God.
Tell us a bit in terms of when you first got your symptoms. Did you know that you had COVID?
No, I did not know. Well, I'm a kidney patient, right?
Right.
So I went to Mount Hope to get the fluid drained from my body after something that I have too much after. And they do the COVID test, and I come back positive.
Oh.
Right?
So you didn't have a flu?
No, I didn't have a flu.
So you got any sort of symptoms at all?
Yeah, I was weak. I was real weak. I wasn't having no fever, no headache, and just nothing. I was just weak, and I couldn't help myself.
Right.
So after a while, like your body started to make them more every day.
Right.
Every day I can get up to go to the washroom. I was real weak and tired.
How was your breathing at that point?
At that point, my breathing was good. And when I tested positive at the summer appeared, in seconds, I'm telling you, this thing dangerous. In seconds, my breathing jumped. I had on 2 oxygen tanks. One, the oxygen tank, and the next one was on the wall. I was breathing it, right?
Right.
And I couldn't be up because it was going down. I had to take it off. I had to take off oxygen from my face. The oxygen going down, my level going down very fast.
And what that felt like when you see the oxygen going down, like you trying to breathe?
Frightening. Very frightening. Like in a pool of water, and it shine like nothing going in the system.
You're getting difficulty breathing.
Very bad. I had to take off. That one oxygen, I was on 2. I had to take off one. That is it.
You had to be on the 2 all the time?
Yeah, you have to be on the 2 all the time.
And you were gasping for breath?
Yeah. It was so bad that and start to pump the blood.
I'm Dr. Osafu Fraser, County Medical Officer of Health for County St. George East. Yes, the COVID-19 vaccines work. Based on the research conducted in many countries globally, we know that approved vaccines significantly reduce your chances of both getting and spreading the virus. Even if you do get COVID-19, the vaccine is effective at preventing you from getting very sick, ending up in hospital, and dying. Simply put, the COVID-19 vaccine can save your life and the lives of your friends and family.
So Dr. Taylor, based on what the patient just said, is this a common occurrence with patients who are COVID positive?
So it's actually not uncommon. So essentially you can be normal and then all of a sudden you have difficulty breathing. You know, you need like 3 times the amount of oxygen you initially needed because COVID attacks the body in such unique ways that you can actually have severe damage occurring in an instant. And sometimes it could be so severe that the patient can immediately die.
What?
Yeah, it can happen so suddenly. We have seen it. One of the most common causes is something called a pulmonary embolism, where you get a massive clot in the lung, and essentially it blocks all the circulation throughout the lung as well as the heart, and it can result in immediate death.
So in 1 minute you're breathing fine, next minute you're gasping for breath, and right after that you're dead?
Yeah, it actually happens, and luckily we have the ability to detect sometimes, but most of the time when it reaches so severe, there's little to nothing that can be done.
Some patients have also said that they feel as though they are suffocating. Is this a common occurrence?
Yeah. So essentially, as the disease progresses, you have intense inflammation occurring within the lungs that cause something called respiratory distress syndrome. And you have a lot of the fluid leaking out into the lungs, so it actually feels like you are drowning.
Now, Doc, we were there and we were in the hot zone. You showed me the donning process, how we put on all of the PPE. And now we want to show you all a clip of the doffing process. Now that doffing process, you can walk me through it while we show the clip?
Yeah. So essentially, we have a specialized technician who is trained in the art of doffing, and they would spray, right? So they have a special sanitary spray that is used to cover the whole PPE that you have on, and they spray it to decontaminate it. Right, and then you have to take off your PPE in a stepwise manner so that you don't recontaminate yourself, right? Because you don't want to get infection. So, you take off the gloves, you take off the gown, and then you re-sanitize. Then you take off the hairnet as well as the face shield, and then you take off the mask. And you could spray your shoes as well, or remove your boots if you are wearing boots. And then you exit.
Because I was wondering, how come we're not hearing too many cases of doctors and nurses contracting the virus, seeing that you all have to deal on a day-to-day basis with COVID-positive patients? So am I correct to say that it's because of these protocols that are in place where the PPE is what is helping you all to get that barrier?
That is precisely accurate.
All right, good. So now a bit personal. In terms of, you have been on the front line for a while. Since the pandemic has started, you have been there. So how has the pandemic affected you personally? And is there a difference from last year to this year in terms of how it has affected you?
Well, personally, we deal with a lot of a high patient load. So we have what we call spikes and troughs. So the numbers will increase at different points and decrease. I would say that this year is different. Last year, we had a spike, but the level and the severity of patients' illnesses were not as severe as now. Now, most of the patients are actually coming in quite ill and already need that type of critical care from inception. So that is a burden now on the whole system, that you have to recruit more energy in dealing with each case.
Right. And how you deal with death? You'll be in these facilities, patients may be dying. We've seen how many dying on a daily basis. I'm not sure if it would be in your facility or if it's spread across, but how do you deal with patients dying?
Well, I think it takes a two-step method. So you have the situation where you are present in the moment, as well as what you do on the outside. So when you're present in the moment, you have to take a mature approach, and you have to realize, okay, what went wrong? You have to be able to take any critique in case something went wrong in the system so that you can make it better to make it not happen next time. You also have to be able to realize that, okay, this person died. You have 50 other patients waiting on you. So you have to be able to get back into that gear, because if you're unable to function, those patients would suffer as well. And on the outside, now you look at your mental health. You have to do things that can relax you while you are outside, so that when you return to the facility, you're able to provide your best service.
But do you ever feel a sense of guilt where you have a patient that you're taking care of and that patient dies? Do you ever feel as though it's on you?
It depends. Sometimes, you may feel a little extra connection, especially if you were there from the beginning with them and you build that type of relationship, and then suddenly you see that person, decompensate or start to get critically worse, and then there's nothing much that can be done. You would feel sad.
And how you personally deal with your mental health in this whole pandemic and having to deal with seeing all of these things?
Yeah. Well, I like to work out, exercise.
We could see the guns. We could see the guns.
Yeah, and always reflecting and trying to make yourself better. Realizing if you made a mistake, you don't want to make that mistake again. It takes a maturity approach to do that. Yeah.
All right. So, do you say that you would put time for yourself, for you to get that mental stress out and de-stress yourself?
Yeah, because if you return to the facility and you are bringing baggage from home or from anywhere else, you can't operate optimally in the facility. You can't give the best level of care, So you always have to make sure that you have the correct mindset of positivity, that when you go in there, you are trying to save lives, you're trying to make a difference, not a negative mindset, and then something happens and you ignore it, and all these different things.
So you feel the mindset of a doctor that enters a facility could affect the care that a patient would get?
100%, yeah.
So is it that you'll have to go in with a positive mindset every day?
Well, this is my perspective, right? And that's how I operate.
Yeah, because I think a doctor human as well.
Yeah.
Sometimes you may have a bad day.
Yeah.
And is there something that you would practice to put yourself in a better frame of mind to head in there?
Well, generally, I have a positive mindset, but I make sure I say, okay, you know what? I establish, all right, we have 60 patients. We isolate and determine who is the sickest patient, and you focus all the energy there, because that will have the most impact in terms of reversing the trend of things, right? Also, you have to know how to budget your time, how to utilize your efforts, because we have to understand that movement is not achievement, it's not the same thing. So you have to, it's all about focusing the energy on critical tasks that can have big results and being efficient. The team as well is so important. Yeah.
What is the camaraderie like amongst the team of doctors?
It's very good, right? And I would always say that in a high stress level environment, if you don't have a good supporting team or staff, it just makes everything worse, even down to the janitors, the cleaners, the nursing staff, the radiology team. If anyone doesn't perform their task properly, the gears will not turn. You will have one aspect of that system being stressed. And, if you're stressed too much, you'll break. And then we start to see things going out of whack and all these different things happening.
Because that was a comment, I was going to find out if there's a rift between doctors and nurses on wards when it comes to dealing with patients.
No, our unit is actually a solid one. We teach nurses, we rely on nurses, especially when it comes to, identifying when patients are deteriorating. Sometimes, a nurse will call us and be like, hey, doc, this patient's oxygen is 50%. What to do? And, it's a team effort.
Definitely a team effort. So we are going to take a pause as we head into our mindfulness moment, where we get you to relax, reflect, and get refreshed as we come back.
Hello and welcome to our mindful moment. I'm going to encourage us today to think about ourselves not as single, isolated beings, but as part of a wider community. So an important part of our mindfulness practice is to have what's called our kindness and compassion practice. And this reminds us that it is really powerful to send kind thoughts to others and to ourselves. So in order to get into this practice, I'm going to invite you just to get into your mindful bodies. And we're really just going to spend a minute just breathing in and out. And just picture somebody in front of you who you really love, who's very dear to you. Imagine them looking at you with love. And I want you to just send back that love to that person while saying in your mind, may you be happy, may you be healthy, and may you be loved. Good job. You're going to take that to the wider community now, maybe your school or your environment or your neighborhood where you live. And just picture all of those people around you. You're going to send out the same wishes. May you be happy. May you be healthy. May you be loved. And then you're going to bring it back into us now, right back to yourself. And imagine you're sending back that love. All of those people are looking at you with the same loving attention. And you want to say to yourself, may I be happy. May I be healthy. May I be loved. Being compassionate with ourselves is really important. And it's a vital part of being here now.
It's Rome, and we are here. We're chilling with the boys. We're liming with the kids. We're doing this all for the PED CARES Foundation. So we need you at home watching us to go donate, donate, donate. Head over to the pedcares.org and send that donation, whether it's via credit card, direct transfer, because we want to make sure that the kids of our pediatric emergency department get the best possible care that they can get, because we need to take care of the next generation. The future lies with the kids. You all ready? On three, we go and say yeah. 1, 2, 3. Yay! The PED CARES Foundation. All right, and we are back from our mindfulness moment. We're here with Dr. Taylor, and he's given us the insights into how it affected him personally in terms of the pandemic. How do you think this really affected you, both in work and outside of work? Was there anything that jumped out at you when thinking back at the entire stay there?
I think the most difficult part right now is that patients are coming in quite sick, and despite what we do, sometimes we cannot save their life, right? A lot of the time they come, on the maximum amount of oxygen, and we throw the book at them. We give them every single possible treatment that the WHO has to offer. And despite this, they still deteriorate and they still die. I think that is the most difficult thing, to know that no matter what you do, you can't save everybody, and a lot of persons end up dying.
Right. And how would you think this has affected your personal life?
So personally, it has been very damaging to my whole regular routine, right? I'm unable to, go to the gym and stuff. Yeah.
Well, yeah, you can't go to the gym, and I know that was a stress reliever for you.
Yeah.
So for a while, you probably wouldn't have been able to do some of those things.
Yeah, so I had to buy weights and all these different things and work out at home, but yeah, it's very serious in terms of it has changed your whole outlook of life, your whole, the way you do things on the outside. You can't go to dinner, you can't, do a lot of things that you would have done before. So I think that, if everybody was to, be vaccinated, that can help, alleviate this tension on the outside in terms of returning to normalcy.
And how do you propose we could try to encourage some more of the younger people, even people on the generally in terms of Trinidad and Tobago, to go out and get their shot?
I think the biggest thing that we could do is dispel the myths, because a lot of people are caught up in the conspiracy theories, and they tend to listen to whatever they hear, their peers say, and they are easily influenced. People need to be have scientific minds and really look at the research, look at the evidence. People are dying in front of us. As far as I'm concerned, that dispels all myths. People are dying, so we need to do something to prevent that from happening. What we are seeing is that around 90% of the deaths are unvaccinated.
Right.
So I think that is a powerful tool. The persons who die are not vaccinated.
Majority of the people that you all, and on the wards, from what you all are seeing, is it a disparity in terms of the number of people who are vaccinated versus unvaxxed, who you all are seeing at the
A
wards?
major disparity, and what we see is that yes, vaccinated people end up in the hospital. However, they tend to do well, right? Even if they have comorbidities, they tend to live, right? Sometimes they spend a month in the hospital, but they live, they walk out, and they do well. But you're unvaccinated and you have even one or two comorbidities, sorry.
It is a tougher time for them to survive.
Yeah.
So you all heard it here from Dr. Taylor. Thank you very much for all of the insight that you have given us, and thank you very much, I must say personally, for taking me into the hot zone and see everything. I got to see everything. I got a lot of calls and messages of people who saying that they loved that episode, and that's why we wanted to bring you back to kind of explain a little more in depth as to what really took place there. As we said, we couldn't have spoken while we were in the hot zone because of the amount of PPE that we had, but today I think we dived a bit deeper and we gave you all that second insight to that hot zone facility. So ladies and gentlemen, thank you all very much for joining us for another episode of Homefront. My name is Rome. Thank you to the PED CARES Foundation. Make sure you go donate. We're doing this for the kids and to dwellings for keeping us fancy. It's Rome and we out of here.